Yes, sir. And any fever at all?
During the COVID-19 pandemic, concerns loom in every medical practice. Physicians worry about protecting themselves and their staff with adequate personal protective equipment, or PPE, as they care for patients. PPE in short supply.
So normally our face masks would be right here. And as you can see, it's empty. And we would have, extra boxes probably stashed in one of the cabinets down here.
Like Dr. Robin McCarty, for nearly all Texas physicians, the PPE shortage exacerbates this crisis. Her practice has just a handful of N95 masks and other protective gear.
We have responsibility to ourselves and our staff to protect ourselves and our staff, because if we go down, then that front line is gone and the ERs are going to get overwhelmed. We feel like we have an obligation to try to sort out who's the worried well, who are the worried but mildly sick, who are the sick or sick, and then appropriately triage the sick.
Faced with a difficult decision, Dr. McCarty called a friend with a question.
I said, I just want to run this past you. We cannot get masks. And if we can't get masks, we are going to get sick, and we don't know what to do.
What do you think we can do?
What would be the feasibility of sewing some masks if we could kind of figure out some materials that would give us some protection, knowing that it's not going to be N95s, but at least some protection.
And I said, well, let me try to put some prototypes together.
So Dr. McCarty's friend, the Reverend Yana Alra Osborne, a retired chaplain, started sewing prototype masks. She did so after she and the physician researched what materials might be most protective.
It seems to be going pretty well, and we think we've come up with something that's as good as it can be. I am not pretending that these are N95s. These are stopgaps. They're better than nothing, but they're definitely not N95s.
There's a little pocket in it, different materials that would provide a little bit more protection for anything coming on this way. And then they're washable. You can bleach them. I mean, over time they'll eventually fade, but so what? They'll still work.
At the same time, the CDC issued new guidance about homemade masks for healthcare workers starved for proper PPE, alternatives as a last resort. Maybe these two were onto something.
It's not a matter of just taking care of the patient. It's a matter of taking care of myself, taking care of my staff, and taking care of the community. And so that just takes something that should be fairly straightforward and magnifying the degree of difficulty and complication probably tenfold of what it needs to be.
Reverend Osborne has sewn more than 20 masks, more than 8 layers thick each, of cloth diapers and other fabrics, plus a pocket in each to hold a plastic-coated nursing pad or sanitary pad. While not the government standard of protection, she and Dr. McCarty believe they will be better than nothing in a pinch. Something for now, until more sanctioned PPEs like N95 masks arrive, whether in large quantities or small donations.
So here's the ones that the jeweler dropped by. It's four N95s. I know.